If you care about your health and want to stay ahead of diseases, subscribe now. I post videos that could literally save your life. Things your doctors rarely discuss with you. Blood sugar, or glucose, is a vital energy source for the body's cells. Glucose molecules circulate in the bloodstream, transported by red blood cells. These molecules adhere to the surface of red blood cells, indicating their presence. The concentration of glucose in the blood is precisely regulated by hormones like insulin. Maintaining balanced blood sugar levels is crucial for overall health and cellular function. Deviations from normal levels can lead to various health complications. A professional voice introduces the critical topic of hidden health dangers, emphasizing its importance. The setting is a clean, modern doctor's office, establishing a credible and authoritative environment. A medical professional is present, reinforcing the expertise behind the health information shared. The calm and professional tone ensures the audience receives vital health insights effectively. The pancreas is a vital organ located in the abdomen, playing a crucial role in the endocrine system. Within the pancreas, specialized cells called beta cells are responsible for producing insulin. Insulin is a hormone essential for regulating glucose metabolism in the body. Its primary function is to facilitate the transport of glucose from the bloodstream into cells. This process ensures that cells receive energy and helps maintain normal blood sugar levels. The pancreas, a vital organ, plays a crucial role in regulating blood glucose levels. When blood glucose rises, the pancreas releases insulin, a key hormone. Insulin travels through the bloodstream to target cells throughout the body. Upon reaching a cell, insulin binds to specific receptors on the cell surface. This binding enables glucose to enter the cells, preventing its accumulation in the bloodstream. Hyperglycemia is a medical condition characterized by an abnormally high level of glucose in the blood. This state is often referred to as high blood sugar, indicating an imbalance in glucose regulation. Under microscopic examination, the bloodstream reveals an excessive concentration of glucose molecules. These molecules circulate in the blood, exceeding the normal physiological range. This visual representation highlights the core issue, an overabundance of circulating glucose. Sustained hyperglycemia can lead to various health complications if not properly managed. Dietary choices significantly influence blood sugar levels and overall health. A healthy diet includes whole grains, fresh vegetables, and lean proteins. Conversely, sugary processed foods are detrimental to metabolic health. Poor dietary choices, especially high sugar intake, lead to elevated blood sugar. Maintaining balanced blood sugar is crucial for preventing chronic health issues. A sedentary lifestyle involves prolonged periods of physical inactivity, such as extended sitting. This contrasts with individuals who incorporate light exercise into their daily routines. Physical inactivity has significant physiological consequences for the body. One key effect is a reduction in glucose uptake by muscle cells. When muscles are inactive, they become less efficient at absorbing glucose from the bloodstream. This diminished uptake contributes directly to elevated blood sugar levels, impacting metabolic health. The body's stress response involves a complex interplay of hormones and physiological changes. When stress occurs, the adrenal glands release cortisol, a primary stress hormone. Cortisol plays a crucial role in regulating various bodily functions during stressful situations. One significant effect of cortisol is its impact on blood sugar levels. Stress hormones, including cortisol, can elevate blood sugar by increasing glucose production in the liver. This mechanism ensures the body has sufficient energy to respond to perceived threats. Genetic predisposition refers to an increased likelihood of developing a disease due to inherited genetic factors. These factors are encoded within an individual's DNA, represented by specific genetic markers. Intertwined DNA strands illustrate the complex hereditary information passed down through generations. A highlight on genetic markers indicates the specific regions of DNA associated with certain traits or risks. Such predispositions can significantly increase an individual's susceptibility to conditions like high blood sugar. Polyuria is a medical condition characterized by the excessive production and excretion of urine. The kidneys play a crucial role in filtering blood and regulating fluid balance in the body. When blood sugar levels are elevated, the kidneys work harder to remove excess glucose. This increased renal activity leads to a significant rise in fluid excretion and frequent urination. Polydipsia is characterized by excessive thirst, often accompanied by a dry mouth. This intense thirst is the body's response to significant fluid loss. Frequent urination is a common cause of this fluid depletion. The body attempts to replenish lost fluids, leading to a persistent urge to drink. Unexplained weight loss is characterized by a significant, unintentional decrease in body mass. This occurs despite consistent or even increased food intake, indicating an underlying issue. The primary cause is often the body's inability to properly utilize glucose for energy at the cellular level. When cells cannot access glucose, the body compensates by burning its own fat reserves. Subsequently, if fat stores are depleted, the body begins to break down muscle tissue for energy, leading to further weight loss. Polyphagia is a medical term for excessive hunger or increased appetite. This condition causes an individual to feel hungry even shortly after consuming a meal. It is often characterized by persistent and insatiable cravings for food. The underlying mechanism involves cells being starved of glucose, their primary energy source. Despite adequate food intake, the body's cells cannot properly absorb or utilize glucose. This cellular glucose deprivation signals the brain to demand more food, perpetuating the hunger cycle. Blurred vision can be a temporary visual impairment, impacting clarity and focus. This phenomenon often stems from osmotic changes within the eye's delicate structures. Specifically, high blood sugar levels are a common cause of these osmotic shifts. Elevated glucose in the bloodstream can draw fluid into the lens of the eye. This influx of fluid alters the lens's shape and refractive properties. The resulting swelling of the lens leads directly to the experience of blurred vision. Persistent skin lesions often struggle to heal, indicating underlying physiological issues. Elevated glucose levels are a primary factor contributing to delayed wound healing. High glucose impairs immune function, reducing the body's ability to fight infection and repair tissue. It also diminishes blood circulation, depriving wounds of essential nutrients and oxygen for recovery. Neuropathy refers to damage or disease affecting nerves, often causing weakness, numbness, and pain. A common cause of neuropathy is prolonged high blood sugar, as seen in diabetes. Elevated glucose levels can directly harm the delicate nerve fibers throughout the body. This damage disrupts the nerve's ability to transmit signals effectively. Symptoms include numbness, tingling, and pain, particularly in the hands and feet. Chronic fatigue is a persistent state of tiredness, often experienced despite adequate rest. This condition can manifest as a profound lack of energy and general lethargy. A key factor in fatigue is insufficient glucose entering the body's cells. Glucose is the primary energy source required for normal cellular functions. Without sufficient glucose, cells cannot produce the energy needed, leading to fatigue. Regular physical activity, such as brisk walking, significantly impacts cellular function. Exercise enhances the sensitivity of cells to insulin, a key hormone for glucose regulation. Increased insulin sensitivity allows cells to more efficiently absorb glucose from the bloodstream. This improved glucose uptake directly contributes to lowering overall blood sugar levels. Consequently, consistent exercise is a vital strategy for maintaining healthy glucose metabolism and preventing related health issues. A balanced meal is essential for maintaining optimal health and bodily functions. Such meals typically include lean proteins, which are vital for muscle repair and growth. They also incorporate fiber, crucial for digestive health and satiety. Complex carbohydrates provide sustained energy release, preventing sudden energy drops. Consuming a balanced diet helps regulate the absorption of glucose into the bloodstream. This regulation prevents sharp spikes in blood sugar levels, promoting metabolic stability. Adequate daily hydration is crucial for maintaining overall bodily health and proper physiological function. Sufficient water intake directly supports optimal kidney function, a vital process for waste removal. The kidneys utilize water to excrete excess glucose and other metabolic byproducts from the body. Proper hydration also ensures the maintenance of fluid balance, essential for cell and organ performance. Regular medical checkups are essential for maintaining health and detecting potential issues early. Consulting with a healthcare professional provides expert guidance on various health concerns. Open discussions about symptoms are crucial for accurate diagnosis and effective treatment. Early detection is key, especially for conditions like high blood sugar, to prevent complications. Proactive management strategies can be implemented based on timely medical assessments. Oral medications are a common treatment for managing blood sugar levels in individuals with diabetes. These medications work through various mechanisms to help regulate glucose in the body. One primary action is improving the body's sensitivity to insulin, allowing cells to absorb glucose more effectively. Another mechanism involves reducing the liver's production of glucose, thereby lowering overall blood sugar. Some medications also slow the absorption of carbohydrates from the digestive tract, preventing rapid glucose spikes. Insulin therapy is a medical treatment for individuals whose bodies cannot produce sufficient insulin. This therapy supplements the body's natural insulin production to regulate blood sugar levels. Proper administration of insulin, typically via injection, is crucial for its effectiveness. Medical visuals demonstrate the safe and correct technique for insulin delivery. Accurate administration ensures optimal blood sugar control and patient well-being. This video is provided for informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider. Do not disregard professional medical advice or delay in seeking it because of something you have seen here. Reliance on any information provided in this video is solely at your own risk. This segment concludes with a clear call to action for viewers. The primary objective is to encourage subscriptions for continued access to health information. Subscribing reinforces the channel's mission to empower individuals with knowledge. This knowledge is crucial for effective disease prevention and health management. The call to action serves as a direct invitation to join a community focused on health literacy.